It is now my pleasure to introduce our panel today. And I want to start by thanking them for their commitment and dedication to writing the planning guide, Planning for Lifelong Care, which this webinar is based off. Joining me today is Andrew Ortez, staff attorney with the Transgender Law Center, Ames Simmons, senior fellow, Duke University Law School, and Kylie Matta, senior director of diversity, equity, and inclusion at SAGE. Thank you all for joining us today. And Kylie, I'm going to turn it over to you for a few opening remarks.
Absolutely. So thank you all to everyone for being here today. It's a pleasure to welcome you all into the space. My name is Kylie Matta, she, her pronouns, and I do apologize if I'm a little inaudible. I'm overcoming a case of laryngitis, quite seasonal as it were. But so I'd like to say a bit about the history of this initiative. And so for the last, I would say about 7 to 8 months or so, Ames, Andrew, and I have been working on this document that was essentially the kind of like brainchild of Ames. And essentially what we were looking to accomplish was to help demystify some of the proactive processes that TGNB people across the country can engage in to make sure that their wishes are respected in the event that they age into a situation where they are not able to make decisions of their own volition or on behalf of themselves for medical reasons. And so this is essentially a tool that we put together that takes into account various state laws, as well as some best practices around kind of like different scenarios that folks might want to opt into preemptively. And so that's what we're going to be speaking about today. And that's kind of the intention of the project, is to equip PGMB people across the country and by extension around the world with the tools that they need to make sure that they do not find themselves in situations where their wishes as pertain to identity or presentation or really a host of other matters are not respected because of medical reasons.
Thank you so much, Kylie. And Ames, you and I first started discussing the need for this guide about 2 years ago. And I don't even know how many calls we had and discussions we had, but I was so excited when you reached out and shared, that you had connected with Andrew at the Transgender Law Center. And then we were able to introduce you to Kylie as well to really help, bring this idea to reality. And so I'm just really excited to have all of you with us here today. But, I wanted to start with you, Ames, to see if you could share more about, how this collaboration came about and really the importance of this work.
Thank you, Cheryl, and thank you to SAGE for sponsoring this webinar and to Transgender Law Center for this whole collaboration. This is a project that has been in my mind for almost 10 years now, coming out of a session about end-of-life planning for transgender people at a conference that I went to. And the conference was not about advanced directives, but since I'm a lawyer by training, legal tools were what I thought of. And I started working on trying to actually draft this language. And that was a side project for a long time. So it just didn't get done and didn't get done. And I was able to really focus on it when I went to George Washington University's LGBT health policy and practice program. This resource was the output of my capstone research project. And it really helps build on work that Transgender Law Center already had underway. And this resource is primarily intended as a tool for community members. I'm a white queer, white, transgender guy. And as a member of the trans community, I really wanted to provide something that would help other transgender people with any fears or anxieties or even depression that they might have thinking about long-term care, thinking about what might happen with dementia. So this is, not a peer-reviewed thing, hasn't been through a feasibility study or anything like that. It's really Although I would love it to get some funding to do such a feasibility study, this is really intended as a community resource.
Thank you so much, Ames. Andrew, would you like to talk to us some about the Transgender Law Center and how you see this tool supporting your work and other resources you might have?
Yeah, of course. And thank you. I'm thrilled to be here, and I have really appreciated the partnership of everyone on this call. It's been great. So Transgender Law Center is the largest trans-led organization probably in the world, definitely in the United States. One of the great resources that TLC has is a national legal information help desk. So trans and gender nonconforming folks from all over the United States can reach out to our legal information help desk if they have any type of question, including questions around some of the issues that we're going to be touching on today, but really like anything. And it's both a great resource for community members and folks that have questions, but it's also it's a great resource for us to kind of see what is coming up and what are people having questions and issues around. And so some of those questions and some of those concerns have really informed a lot of the resources that TLC has put together over the past few years. Some of the bigger ones that we put out are constantly updating ID Please, which is an identity documents guide really for California state, but then it also has federal stuff that's applicable to everybody. And then two of the bigger ones that we put out in the last 2 years are a guide on preparing for law enforcement interactions. So if you know that you're going to come into contact with law enforcement for whatever reason, we were thinking about this a lot during the uprisings in 2020 and a lot of protests. And obviously there's unfortunately never not a time that it seems that we'll be protesting. You can check out that guide and get some ideas in advance, and then also for reporting law enforcement abuse. Anyway, at the beginning of the pandemic, it was obvious that folks were really concerned about end of life planning or life planning and what to do if something were to happen where they became sick and wouldn't be able to make decisions and all that kind of stuff. So TLC put together life planning resources guide for trans and gender nonconforming folks. And that has been really useful, and it covers all 50 states, has information in there that's applicable to everybody. And so that's why I was so excited when Ames reached out and shared his information with us and was willing to trust TLC to be a partner in developing this resource that I think is super important. And I'm just really glad that we were able to provide any sort of support to this project. It's very necessary.
Thank you, Andrew. Kylie, did you have anything else to add?
Absolutely. So I presume that many people on the call are familiar with SAGE, but just a bit of background. SAGE is the oldest and largest agency in the world dedicated to the well-being of LGBTQ plus elders. And so kind of my connection to this project came via Cheryl. Thank you so much, Cheryl. And essentially in my capacity as Senior Director of Diversity, Equity, and Inclusion at SAGE, pretty much every day I spend my time like looking at different projects and seeing, asking myself and asking the people involved in the project, what are we missing? Who's not included, and how might this work resonate differently with different people? And so that was the idea behind my inclusion on this project, was just to kind of like bring that lens that I use for other aspects of my work. I'm sorry. And to kind of just like make sure that this document is as useful and accessible for as many people as possible across the country. And so that was my apport, as it were. Also, I think just as a member of the community, as a member of the TGNB community, this is something that I care deeply about. I have seen both in my personal life and in my work at SAGE, the ways that LGBTQ plus elders, specifically TGNB elders, the way that their wishes are not respected, often in old age or when they age into medical situations where they're not able to consent to various things openly. They're often, like, decisions are often made for them by people who don't have their best interests at heart. And that's a huge problem. And so that's something that I'm very passionate about addressing. And also I just think that you know, this project is like another way of kind of hopefully complicating, in a good way, our understanding of TGNB identity in life in a way that it doesn't often happen. We of course just finished with Trans Awareness Week and with Transgender Day of Remembrance that happened last week, and those are very important moments in our cultural kind of like in our cultural life to shed some light on the issues that affect our community. But hopefully this document will contribute to people keeping these issues and these questions top of mind throughout the year. And so, yes, I was happy to be a part of it.
Thank you so much, Kylie. And, you know, as I think about the work that we've done at Sage, you know, over the last 40 plus years, and my time with Sage, you know, really since 2008, I've often had people ask me, how do we best support older adults who identify as transgender or non-binary? And I think one of the concerns is around dementia. And, you know, should a person not be able to communicate their wishes or share, you know, the things that need to be shared about their life and about their care? You know, this is oftentimes where that concern comes from. And, you know, this leads us to this next question, that the Transgender Law Center in 2020 shared a resource about life planning documents for transgender communities. And, you know, so how does this work fit into some of those resources that you already have out there, Andrew? And, you know, any thoughts about, you know, how we can best use this information?
Yeah, sure. So in some respects, I kind of view as the resource that we're focusing on today as an extension of what TLC put out in 2020. 2020 was kind of the life planning guide that put out in 2020, which is kind of an overview of what living will is, advanced healthcare directives, and just, you know, kind of walk folks through what are the documents that you could work on now to protect yourself in a situation where you might not be able to advocate for yourself. As queer and particularly TGNB folks are often have to be their own best advocate. And so to think about a time when you may not be able to advocate for yourself can be really scary, because you might not have the community and the support network that some other communities have a little bit better access to. And so the way, as thinking about this as kind of an extension of that, it's really very complementary. Like the sample language that we have connected to today's resource is not something that you would just have stand alone. You would really want it to be paired with hopefully a will, other advanced healthcare directives, and other documents. It's not just something that's going to be sufficient in itself. I also think that the guide today and the questions that AIMS have come up with are really helpful to think about, not only in the context of dementia. I mean, that's how they were created, but the questions can really start thinking, are things that you can start thinking about now about other situations where maybe it's not dementia that's limiting your ability to make your own decisions or have autonomy over what your medical care looks like, but just kind of starting to have those conversations and think about now. And I think for me, it's also, it brings it closer to the present, because anything could happen to any one of us at any time. Dementia is something that, you know, is something I've experienced in my own family, but at the same time, I want to push it very far away and think about, that's not me, I'm still young, and, you know, but these are conversations that we should be having now, and documents that we should be looking at and thinking about now to really prepare ourselves for whatever comes in the future.
I think if I could, that is one of the reasons why Transgender Law Center made such a good partner for this project, because of the orientation toward community lawyering and following the lead of transgender and non-binary people who are most affected by you know, the conditions that we live in society today. And it was especially important considering this emerging research that's showing that Black and brown transgender people may have, and or at least report greater rates of subjective cognitive decline, even compared to white trans people. And so we really, TLC has always been oriented toward following the lead of Black and brown trans people, and really taking as much into our own hands as we can, because so much control is taken away from trans and non-binary people in so many other situations. Yeah.
Kylie, do you have any thoughts you would like to add?
I mean, I absolutely do. Like, I just kind of like want to piggyback off something that Andrew said, that I think that, especially the way I framed it earlier, I framed this as something that is pertinent to people as they age, but in reality, right? Like this can be of use to anyone at any age, right? Like we should be planning for our future, whether we're 25, 35, or 65, right? Like we don't know what tomorrow will bring when it comes to health, especially. And so it's really important to keep that top of mind, that this is not necessarily something that we should think about as only being pertinent to people in a certain stage of life. Like, I think that this really is a useful tool for people throughout their lifetimes, TGNB people especially, and as Aim just said, particularly folks of color who may not have access to different forms of support, or the different kind of avenues of advocacy, like on their behalf. And so thank you both for lifting up those really important points.
I thought of one other thing to build off of Kylie and Andrew. This would be a good time for me to talk about that TLC has a disability rights project. They actually have a survey for trans people of color who are deaf or living with a disability right now. And the disability rights project review of this document, as well as my own kind of journey of thinking about the ableism that is implied in the way that we think about dementia, has been it just completely changed the way that this project went. Like, for me, coming at it as a relatively binary transgender white person, just what's right for me doesn't fit the life circumstances of a lot of people in the trans and non-binary community. And I think it's really important to bring disability into the discussion.
Yeah, and we have a couple of comments here in our chat right now that's going to the hosts and the panelists about the increased incidence of dementia with the LGBTQ plus community. Would anyone like to maybe talk about that?
Since I spent months researching this, I'll tell you what I have found, which is that as a general principle, we have not spent enough time and effort and resources in researching aging, full stop, let alone aging within the LGBTQ community, which is a space that SAGE has been filling for 40 years, like Cheryl said. And there's so many good resources that on SAGE's website and the National Center for LGBTQ plus Aging, especially when it comes to trans and non-binary people, there's even less of a evidence base. So a lot of what I was initially coming across was, things that clinicians were reporting that trans people had said to them, and not actual trans people speaking about their experiences or even their fears about or anxiety that they had about dementia. But it was still clear in their research that this was something that was of concern to people as they thought about aging. I'm giving you a content warning for suicide. This is hard for me to even say. I over and over again saw reported in the research literature that trans people were so afraid of losing their ability to control their day-to-day experience of their gender identity, that some people resorted to what we, quote unquote, detransition, and just tried to live in accordance with the gender that they were assigned at birth, which we know from research how damaging that is to trans people. So it's just not an option for a lot of trans people. And over again, we saw trans people telling researchers that their plan for how they would deal with dementia was to end their life. And to me, that was that's a state of emergency, you know, that really compels us to have to act both as a community as well as the research community and service providers. And it has been really encouraging. There have been a lot, not a lot, there have been there's been more studies than there were in the last even 2 years. There's really good research being done about LGBTQ people and dementia by Jason Flatt at the University of Nevada, Las Vegas. And there's 2 researchers that I know, one at UVA and another one at University of South Florida, who are really looking at dementia, looking at what trans people need in order to make their advanced directives serve the purpose. So there's right now, I would say we only have emerging research about like what we have thoughts about what might be causing increased reports of subjective cognitive decline, things like chronic minority stress or allostatic load, you know, the kind of physiological manifestations of living in a society that oppresses LGBTQ people, and particularly trans and non-binary people, and even more so for Black and brown trans people, or trans people who are living with disabilities, who are immigrants. All of these things have an impact on our health. And the thought, without, you know, again, with only the beginnings of research behind it, is that another place that may show up in our health is in our cognitive functions.
Thank you, Ames, for that. And I just want to note that in the chat, I provided a link to the Trans Lifeline as well as their phone number. So if you do know of any transgender community members who may be struggling with thoughts of suicide, you know, please have them reach out to these resources. And we will be making all of the resources that we're sharing during the webinar available in a document at the end of the webinar. So, you know, we'll make sure that you have these resources. And this really leads us to our next question. You know, I've oftentimes heard from transgender community members, you know, I'm afraid for what might happen should I need to go into a long-term care setting or the hospital. You know, how do I know that I'm not going to have to hide who I am? And, you know, so why are these life planning documents, you know, so important? And what are some of the concerns that you all are hearing from the folks that you're working with? And Andrew, we'll start with you with the helpline at the Transgender Law Center.
Sure, thank you. Yeah, as I mentioned, TLC has a legal information help desk, and we field all kinds of questions from all over the country. And, you know, unfortunately, these concerns and issues related to decision-making and capacity to make decisions is something that comes up fairly regularly. We have received inquiries from folks who are in a state of declining health, and they're concerned about family members who they may not have even spoken to in years, coming in, swooping in, trying to make decisions for them, trying to take over their lives in ways that, you know, nobody would want, but especially if you're going to be taking away very serious decision making from folks. And these people, like people that aren't even like related to you, not even in your life anymore. That's one thing that often comes up. You know, we get a decent amount of inquiries from friends of folks who see similar situations, see family members coming in and making decisions for their friends, their chosen family that they know is not in their friend's best interest, as Kylie was sort of hinting at earlier. And as Cheryl was mentioning, we get a fair amount of inquiries around concerns about discriminatory providers and going into a situation where you're not able to select who you're going to be interacting with as far as a healthcare provider goes, and concerns about whether or not you're going to get the appropriate treatment, going to be treated fairly, going to be really looked after and really cared for in the way that you should be, especially in a time of increased vulnerability. And then, I think for me, some of the maybe sadder ones are ones where friends and family of trans folks who have passed reach out and are concerned about folks not being respected even in death, and having, funeral services, memorials that just don't reflect who that person was in their life. And those are some of the themes that come up regularly that we see. And and going back to the disability angle as well, is like those are concerns for folks who are older and experiencing decline in health maybe, but also we regularly get inquiries from folks that are disabled or maybe don't have any reason to have their decision-making capacity questioned, but still have folks in their life that are coming in and trying to insert themselves in ways that are just distressing.
I'm happy to piggyback off of what Andrew said there, because yes, I think that I co-sign like everything there, but also just in terms of things I've seen kind of in the field, like very similar. I've seen cases of TGNB, people who are no longer able to make decisions like on their own behalf, and often in care, who, because they cannot make decisions on their behalf, and perhaps they don't have a spouse to speak of or children to speak of, the next of kin might be a family member from whom they've been estranged for decades, right? Because like our medical and legal systems don't necessarily acknowledge, right, the familial structures that sustain a lot of TGNB people throughout their lifetimes, right? The medical system or the legal system might view them as just friends, when in reality they were much more akin to familial connections, and so therefore defaulting to more traditional like definitions of family often exposes TGNB people to essentially kind of like having decisions made for them by people with whom they might not have had a lot of contact, who might not have been particularly fond of them, and just all of that entails. And so I've seen examples of TGNB people who are forcefully, quote unquote, kind of detransitioned, right? They are made to present against their will with a certain gender identity that does not correspond to who they are, and that's particularly distressing, right? And just especially like dystopian, right? Like because they can't consent and they can't refute depending on what the situation is. And so and that's not an uncommon occurrence either. It's not an isolated event that happens with some regularity, unfortunately, for folks that don't have sort of like these advanced care directives in place before they're no longer able to make decisions on their own behalf. So yeah, that's a huge thing that I think this project is looking to address.
So thinking about the mix of all of those conditions together, I think mean that we have to be proactive about talking to the LGBTQ community generally, but also particularly to trans and non-binary people, about how, in the absence of these documents, that clinicians who otherwise don't know what to do they're going to turn to next of kin. And again, I've seen examples of where next of kin are not supportive of a person's trans identity, and might trying to convince the long-term providers or the care team for a trans person who is experiencing cognitive decline, that their transness is a symptom of their dementia, especially in cases where people might be experiencing new or increased gender fluidity, which is has been found within the research literature. And, you know, I think generally we're not, it would be a lot easier, I think, for a lot of clinicians to be like, oh, thank God, like a family member who actually knows and can give me some answers about what I'm supposed to do in this situation. Without, you know, if we don't begin to equip trans people with, you know, some guiding principles, some instructions in their documents about this is the way that I want to be treated. The practical concern that I've heard a lot from, so we know that like part of the environment that makes this next of kin issue exist is the thinner support networks that excuse me, that LGBTQ people generally have as we age. And that is, there's a lot of social isolation, particularly among trans and non-binary people, thinking about the kind of socio-cultural, political landscape that we're living in right now. And a lot of trans people have said that they just they don't want to do these documents because they can't identify anybody that, excuse me, to serve as a healthcare agent. And this is where, so that's why, number one, planning for this is important so that you can be, you know, intentionally build relationships, hopefully with people who will not predecease you, you know, hopefully people who are younger than you are. And I really commend the work that Sage has done around intergenerational projects. And I think this is one of many examples of where younger trans people can learn from the histories of older trans people and can also help to make sure that older trans people are treated the way that they want to be treated. Because you really need to have that kind of person, whether it's a healthcare proxy or healthcare agent, healthcare power of attorney, it's called different things, to kind of enforce the provisions that are in the document around your treatment preferences and what your wishes are as far as the name you want to be called, the pronouns that you want to have used, you know, the way that clothing and grooming products that you even have access to, all of these things are really important in affirming someone's gender, that I think we have to be intentional about building our capacity to deal with those issues as we have trans and non-binary people who are entering long-term care.
Yeah, thank you, Ames. This conversation right here really, for me, just shows the importance of why everyone that's in this room today has joined us. Because for so many folks, you know, as we've been learning, you know, maybe they are aging alone. Maybe they don't have connection back to a you know, network of people who are there to care and support, you know, them as they age. For each one of us, you know, we can pick up this tool that we're talking about here today and help somebody start to think about, you know, what's important for you. How can we help and assist you to start thinking about your future and the documents and things that you need in place to really support you as you age. So I just want to really thank everyone for being here again today. If you've not looked at the guide yet, again, we'll be sharing a link to that in the resources that you'll get at the as part of your registration here today. And, you know, it really walks you through some of these important conversations that we're talking about here today. So any other comments in this area before we go to our next question?
I think
Ames?
I just will add that it's hard to have these conversations for anybody. And none of us are trying to deny that reality. Part of what we're hoping to do with these guiding questions is to provide a framework for people to be thinking about what are their values about their gender identity, what how do they see that as part of maintaining a quality of life, what are their values around dementia, and how they envision aging and long-term care. And it's trans people, and this is old research, this is almost 10 years old, the rate of completion of advanced directives, I think, was 13% in a study that Taryn Witten did, who has been studying aging among trans people for a very long time. And generally in society, people, only about a third of us have advanced directives, and it's even fewer people of color have completed advanced directives. And so, I think part of the equation here is that there's stigma that is attached to talking about death generally in our society and our culture. There's also still, for many people, stigma associated with talking about gender identity. And some of the concerns that have come up are like trans people who are living with mental health conditions like chronic depression, feel concerned about talking about death with their family and their friends out of fear that it's going to give people the impression that they're thinking about dying by suicide. And some of the research around younger people and these conversations, there was one study that I think almost half of the sample was biracial, gender nonconforming people. And they said that having like all of those things, plus having to negotiate racial and ethnic identities on top of it, makes these conversations really complex, and people don't know how to approach them. So I think, part of what we're trying to do with the community-based aspect of this is to bring those discussions in a practical way to trans and non-binary people, again, to, even if we might be worried about our inability to exercise control in the future, but this is one way that we can exercise control now and have at least some peace of mind now. I mean, there's a comment in the chat that I think is worth pointing out, that these laws do vary from state to state a little bit, and so they might need to be updated if you move, and that's totally valid. The other thing is, like, your life changes over time, so this is not something that you should think of as like one and done. As your life circumstances change, you need to think about how or to what extent it changes what you might have put in an advanced directive. And so that can seem really expensive to people, especially if they think that that they can only do this through an estate planning attorney, for example. And I think a lot of the legal fees in those situations are around preparing wills, which is also something people should do, but not what this resource is about. And so there are conversations that we can be having in community through accessible community-based organizations, through the work of SAGE, the work of Transgender Law Center, name and gender marker clinics, for example, medical legal partnerships that many folks go to when they are going to a community health center, for example, that can help us to start putting some of these provisions in place without necessarily having to see a lawyer. Having said that, there are obviously some folks are going to have circumstances that are complicated that you very much should talk to a lawyer about. But I don't think you should go into it assuming that you're required to do these through an attorney or that they're expensive.
Yes. And can I jump in there, Cheryl, for a quick second?
Please do, yes.
I was going to say, again, like co-signing everything that Ames just mentioned, I think that's super important to have in mind. Also, as I think Ames was alluding to in part of his remarks, is that I think it's really important to situate this advanced directive conversation and the overall kind of like estate planning conversation as well. Like there are many different tools that one can use to protect one's future, both kind of like after we're not here anymore or when we're not able to make decisions like on our own behalf. Like this is important for everyone, but especially for members of groups that have been historically cut out from different avenues of power and privilege. And I've seen some comments come from audience members about this, right? Like there is a deficit among people of color in terms of access to these directives, to these tools, and using these tools to protect both like their bodies, their wishes, and their assets, right? Like all of that is important, and especially for those of us who might not necessarily have the support of what the law might immediately recognize as next of kin, right? You know, it's really important to make sure that your wishes, both as pertain to your health, as pertain to your presentation, as pertain to what happens with your stuff after like you're not here. It's really important to just have that written down so that your family, chosen or otherwise, is not doesn't have to fight, right, for what you might have intended them to have access to. So just super important, especially for people who are members of marginalized groups and for people who do not, whose next of kin are what we might describe as chosen family, as it were. Just super important to keep that in mind.
Thank you, Kylie, for that. You know, I would also add we have so many of our Aging Network partners who have joined us here on this webinar today. And oftentimes, you know, I'll get the question, how do we provide outreach and services to the LGBTQ plus community? One example of a service that you could provide is offering a day where you offer planning assistance, you know, to transgender older adults and other members of the lesbian, gay, and bisexual community, you know, to invite them in and talk about the need for these type of planning documents. You know, that's one way that you can really help to do that type of outreach and service in your local community. Andrew, since we're on legal, more of a legal discussion right now, we did have a question that came in the chat, and it was asking if there are any legal cases establishing precedents around, you know, support for transgender, non-binary older adults in planning.
Yeah, you know, that's a good question. I can't think of one. One was not directly jumping to front of mind. I can think of a few. I know of at least one case here in New York that had some of these issues present, but it wasn't like a big precedential case. But it really highlighted it highlighted the need for these documents, but then it also highlighted, as Ames and Kylie have pointed out, the need to, when possible, create a community of folks that will help you enforce the documents. Have folks around you that can really say, like, you know, these are these person's wishes, and even if they're not able to fully advocate for themselves, this is what they want and this is how they should be treated. But I don't have a good example for a case. I don't know if Ames, maybe you came across something in your research. That's something I'd have to think about, maybe ask a few folks and see if there's, but nothing's jumping to mind.
Not about advanced directives. There is a legal case in California about whether long-term care service providers can be required to acknowledge someone's pronouns, for example, and that's something that we hope gets handled by the Supreme Court handily. Yeah, I'll just leave that there. The other thing that I want to say about, so Transgender Law Center's link actually can take you to a fillable form where you can, you know, go through these questions, and it will, based on your responses, it will, you know, try to auto-populate a document that might best fit the way that you're thinking about gender identity and long-term care and dementia. Like Andrew pointed out, these are not standalone documents. You want to add these clauses to an existing advance directive. It is not hard to find the forms for any individual state. Like AARP has a state-by-state directory of the statutory forms in each state. Having said that, this language that we've worked on doesn't appear in any of those statutes, at least not yet. So our work is not done. So, you know, the legal enforceability of these hasn't been tested. I don't know that that's the primary value that this tool brings, though, is, you know, I think it's I think there are very real gains that a person has from thinking about these things, from writing them down, and the way that they will help your loved ones know what kind of care that you want, and help the care team that is around you to know what is most important to you, and how to provide that care. I think that that's really what we were trying to solve for here. And you know, how the legal enforceability, how our jurisprudence evolves around these issues. I'm sure we'll see more of it as our population continues to age at this greater pace, but I don't think we have the answer to that now.
Yeah, thank you for that, Ames. I oftentimes say it's never too early to start planning, but it can sometimes be too late. And our planning is really a gift to those who are there providing that care and support for us, in those times when we may not be able to make decisions for ourselves. And so I think it's just really important, from that place of self-advocacy, to do whatever we can to make sure that our wishes are documented and written down. So thank you for those comments. We are, believe it or not, we are at 3:20, and we're planning to go into Q&A in about 10 minutes. So I have one last question I would like to ask the panel. And, that's, do you have any other resources that you would like to share, with the audience today?
We can certainly make available to y'all, if you want, like a reference list of some of the research that I've pulled from. And I know we'll give you links to like the AARP directory of forms, for example. There are a number of, we're starting to see a number of tools. Yeah, I think I'll leave it there and see what my colleagues.
Yeah, I'll just I'll mention again that TLC, if you go to TLC, transgenderlawcenter.org/resources, as was put in the chat, we have all types of resources, but the life planning guide is there, that has a broader range of things to think about and consider. Of course, the National Resource Center is invaluable. NCLR Lambda and I think Whitman Walker, but that may have also been with the National Resource Center, have some stuff that's a little bit dated, but still it's shorter, briefer one pages that are nice to look at and can be helpful. As someone in the chat mentioned, there is there's like I think it's a Louisiana specific guide, but it's really well done for LGBTQ end of life planning, and there's a lot of stuff in there that's could be applicable to folks anywhere in the country. And as Ames was mentioning, TLC has a partnership with Free Will, so freewill.com/TLC has a really easy form that'll kind of guide you through some of the questions and help you at least get a base for those advanced healthcare directives and will to get those things set up. I know I'm missing some. I'm sure Kylie and Ames have some other stuff, but as Ames said, we'll make sure that this stuff gets put into the resource list.
Yes, and there are, as you all have heard, there are many different kind of avenues of support and like references here and ways to kind of bring this tool to fruition. I think that my co-panelists have been very comprehensive in what they've shared thus far. And of course, we'll be sending out a list afterwards. As a Sage employee, I just have to pick up the NRC explicitly, especially because Cheryl does so much amazing work around our National Resource Center. It truly is a treasure trove of information on many different topics, including advanced directives. So please do check it out.
I think I want to add one additional comment into this. Right now, I think even the way that a lot of older trans and non-binary people are talking about gender is it tends to be in a more binary way. And that's, you know, partly because of the way that the standards of care developed for trans and non-binary people, for trans people. So I have not seen a lot of resources for people who are non-binary. And I think that's one of the, you know, aspects of this decision-making tool that we really had to grapple with. And, you know, it might raise a lot of questions for people about how, you know, from infrastructure or to training, like how are people who are caring for non-binary people going to be able to do so, you know, in a professional and caring manner. And I just think there's so much more that we need to think about and develop for non-binary people. And this was really just the beginning. But I really especially think we need to carry the message that non-binary people are not indecisive. Like this is not a sign that, you know, a person is losing decision-making capacity. It is for many people, gender fluidity is their stable gender identity. And we have to become more comfortable with the idea of fluidity. Maybe like, yeah, it doesn't necessarily say anything about your gender identity. The fact that gender might be, you know, an unstable social construct that we're dealing with. But I also think that we have room to grow in ways that we're thinking about people who are losing cognitive decline. The law looks at this as like a really binary, you either have decision-making capacity or you don't. And that's, you know, clinicians have had lots of conversations with me about how that's not really the way this works. It's not a linear process for a lot of people. And we really need to, I think about, we need to stop talking about cognitive decline as a decline. We need to stop saying loss of decision-making capacity. I think, again, these are concepts that are hard for the legal system to grapple with in the US, but, you know, there are some researchers who've taken a really thoughtful glance at how to incorporate non-binariness and as well as disability into the way that we are conceiving of tools to help people. Again, I can definitely point you toward those resources.
I am feeling a second webinar coming on as I listen to these comments and see the chats. Kylie, did you have something to add?
Yes, and I know we're going to go into the question section, so I'll be very quick, but I did see something addressed or asked in a comment that I thought is important to highlight, the topic of religion, and this particularly because we're talking about health and aging, right? It's like religion often does play a role in that for many people. And so I think to whoever posted that comment, thank you. I think that was like a really important point to make, that while we've spent a lot of this like webinar talking about how this pertains to a person's gender identity and like respecting how they want to navigate the world, like whether or not they're able to expressly state that I would argue that the same could be said for religion as well, right? Like thinking of an advanced directive for gender, yes, but also for like whatever other aspect of one's identity they might want respected in the event that they either permanently or temporarily do not have the ability to make decisions for themselves. That is super important, right? So if you don't want a certain right done for you, then I think this document would be a place to indicate that as well. So thank you for raising the question of religion. I think that's super important. Thank you.
Thank you for that, Kylie. It is important to remember, folks' individuality when it comes to religion and spirituality and what our choices are, at end of life and as a part of this planning process. I'd also just like to add, because I know Ames has brought this up a few times, that many trans individuals as well as gay, lesbian, and bisexual folks actually come out later in life. So, you may be working with someone that for the first time, may be coming out and sharing, about their gender identity or sexual orientation. And you may be that trusted person that they have found to share this information with. So, again, I just want us to recognize that many older adults are coming out as transgender or LGB. So I'd like us to keep that in mind as well. I also wanted to share that SAGE also has another guide through the National Resource Center that will be coming out hopefully by the end of this year. We're getting close to the end of this year, but it's another very comprehensive planning guide, and it will talk about funeral planning, as far as writing our own obituaries and things that we can do as a part of our planning to really make sure that our wishes are written down and have a better chance of being followed, because we've taken the time to really do this planning. And we now want to go ahead and open up for some question and answers. We have a number of questions that have been asked in the chat as well as the Q&A. I'm going to start us off with a Q&A question. We've had a couple of questions around solo aging. And so just wanted to take a few minutes for our panelists to respond. What work has been done regarding services for solo seniors in our community? So folks that have no family of origin or close friends, maybe low income or unstably housed, and feel like they may be forced into the closet or dealing with rejection. So how could this tool or other resources that you're aware of maybe help folks who are aging solo and needing more support services?
Yes. Yeah, this is a problem that we need to grapple with when it comes to advanced directives, because as I said, I think having set forth treatment preferences is a very important way of establishing, your agency over your gender identity. And it's also important to have someone there to insist that those provisions be followed. I know both of my parents' deaths would have gone very differently if they had not had living wills, and also incredibly well-meaning healthcare providers at every turn were trying not to do. They're oriented toward life-saving care, and it really takes someone being there to try to make sure that a person's preferences are followed. So I think there's a potential for us to do intergenerational work here. Obviously, this is part of the answer to trying to work on social isolation generally among LGBTQ people, which we know has a negative health impact. And there are already models for this, like I'll hold up Sage Connects, the program that matched volunteers with older LGBTQ people. I think it started during the pandemic, but to help, at least have like a regular phone call that helped to build. It's important to check in on people, and those relationships were built over time. Is something that, again, that we have to be intentional about. So that's part of, why we're trying to get the word out about having these conversations now.
I would also add that, it's so important for us to also connect older adults that we're working with, especially trans folks, to the local services that are there. Area agencies on aging, we work with them every day around LGBTQ plus cultural competency training and outreach and services. For folks that are aging solo, that connection back to the aging network is critical to help make sure that they have access to services that are there for them and are there to help support them. Andrew or Kylie, do you have any thoughts on this before we go to our next question?
I'll say I don't have anything particularly profound to add, unfortunately. I think this is, as Ames was mentioning, this is just a difficult issue generally. And then when you add other factors into what we're, the problem we're trying to solve, it just makes it more difficult. But I do think that, as we've said today, is like starting to have these conversations and normalizing these conversations is a way to kind of break down the stigma and get people to start thinking about, what do I want my life to look like in the future? And hopefully spurring people on both ends of that spectrum to forge intergenerational connections and connections with folks that need support, so that, I'm always about building community, and we should be doing as much as we can to build community across as many lines of difference as possible. But yeah, I'll just say that I think that starting these conversations early, thinking about how you would like to be treated, and then being on the other end of that and trying to reach out and be the support that you hope you have in those situations.
Yeah, and I think that I would just add in, like on top of these other great suggestions, like I would just say, kind of harken back to something that Cheryl mentioned earlier in terms of having clinics available for people who want to create these tools, right? So like there's like many like different avenues of support, both online and in person, and those are phenomenal. But I do think that the model of just like having like open clinics available so people can walk in, or just so that people can be aware of it, perhaps who might not be at this like webinar, who might not be connected to people who are having these conversations. I do think that like legal clinics are a really powerful way, especially like pro bono, like legal clinics, to those who are generous enough to offer those. I'm looking at Andrew, especially like fondly there. Thank you, Andrew, for all your work. I think those are a really important way of just like helping equip people in the community who don't have the connections or resources that they might need to make sure that they have these in place for when they need them.
Our next question comes from one of the attendees today, and they ask, how do we become better advocates for LGBTQ plus community members within long-term care? They go on to say, I feel as though sometimes our feelings and needs are not being met and are very important. And also that, their spouse identifies as transgender, and they don't feel that they're always being respected within long-term care settings. So open that up to our panelists. Any thoughts? Ames, I know you might have a few.
I'm also happy to like jump in unless things like want to go first. Okay, sounds great. No, I think that just like working at Sage again, very fortunate enough to be connected kind of by my work to Sage Care, which I think is truly a groundbreaking model that Sage has adopted for many years. And essentially like the model there is kind of like training the professionals who will ultimately work with people in long-term care settings. And so that's like that's not my department, but I have many esteemed colleagues who work under that umbrella. And so what they do is that they essentially have a training program, like a very extensive kind of like curriculum set up for healthcare providers in long-term care settings, to essentially help them understand what it means to more empathetically and appropriately work with members of the LGBTQ plus community. So I think that kind of like that sort of like training the provider model is really important, right? So Sage Care is doing that, but there's many other contexts where that might be replicated. I also think it's really important to focus on upstream prevention, as I like to think about it, right? So if we're talking about specifically long-term care settings, right? So there are people who might opt into long-term care settings, but there are, of course, people who who actually might not have the resource that they need to age in place or age at home if that's their desire. And so they have to go to long-term care settings as a result of that. And so if like given that, I think that an upstream kind of like something that we can all do is make sure that there are stronger and more robust protections for LGBTQ plus people when they're working and when they're studying, right? Because we know for a fact that discrimination leads to pay differentials across the lifetime that like essentially like only amplify themselves over the lifetime, right? So if somebody is paid less at the beginning of their career for any reason, they are that right, like if they're paid less than someone doing comparable work, they're likely to continue to earn less throughout their working life and therefore have less resources saved up when they might want to retire and so on and so forth. And so I think thinking about, you know, people, yes, who are in this situation now, but also people who might be there in 3 or 4 decades, right? Like, what can we do now to make sure that people are able to protect their earnings, to protect their livelihoods against discriminatory forces to the extent possible now, today, with, you know, with their futures like down the road in mind. So I think like thinking about folks before they need to be in long-term care settings, long before they need to be in long-term care settings is really important.
I will add the thing that I know Cheryl is anticipating that I will add, which is a new tool from SAGE and Human Rights Campaign Foundation called the Long-Term Care Equality Index. We've just completed the first round of surveys, and this is an important way for LGBTQ people to know about long-term care facilities, you know, in their neighborhood, in their state, around them. What are their policies that are affirming of LGBTQ people? There is a section on gender supports and services that I commend that people look at some of those things that you can put in place. And if you're a worker in a long-term care facility, also advanced directives are part of the criteria for the long-term care equality index. Conversely, this is a way for people who work for long-term care facilities to demonstrate to people in the LGBTQ community that they've thought about, we've planned for you to be here. And these are some of the policies that that we've put in place in order to to show that we have a stake in LGBTQ people's health. So definitely recommend the LEI, the lei.org. Oh, also, yes, there was a comment in the chat about the kind of healthcare workforce problems that we are having. Especially in long-term care. I know that this is something that to really grapple with. And that's another reason why I think you should look at the LEI, is because there's a whole set of criteria about how you take care of LGBTQ workers, whether you have employment non-discrimination, and there are other criteria that kind of go beyond the resident's experience to really think about your employees as well.
Andrew, any thoughts from you?
I don't have anything else to add, though. Kylie and Ames both have great suggestions.
Okay, so next I think is another important question around one of our attendees says that many of their patients can't identify a power of attorney. What steps can we take as providers to help support those individuals? Many have trauma associated with biological families, and they don't want their care to be determined by these individuals.
Another SAGE resource to call out here is the Guide to Person-Centered and Trauma-Informed Care for Older Transgender Adults. Any conversations that folks are having with members of the LGBTQ, with trans and non-binary people, I think it's probably safe to assume that they have encountered at least some form of trauma just growing up in this world. Having said that, I think ideas like the clinics that Kylie mentioned earlier might be a way of trying to source people willing to serve as healthcare powers of attorney. I would love to see like pro bono credit available to attorneys who are willing to serve as someone's power of attorney. That attorneys don't often like, longer term engagements like that, but I think that is an important, this is definitely something that's relationship based.
Yeah, and I would also add that, sometimes from a provider position or, a support person that's there, with an older adult, we may be able to help them tap into their circle. Who is there that they do trust that may be able to help provide this support to them. Sometimes, it's hard for us to ask for help. And I think that's where professionals can maybe help facilitate those types of hard discussions and really help people think about who might be there in the circle in your network that can help, provide this level of support for you. And I'll just open it up to the panel too. I see that you're also looking at the questions. If there's something that you want to address that you're seeing, feel free to go ahead and pick out a question and address it.
I'm not going to do that, but I will say just from the chat and the questions that we received today, and yeah, I think this is obviously a sorely needed conversation, and I look forward to continuing this conversation with some of the folks that are here today and the folks that I've already partnered with. But yeah, there's clearly a lot of stuff to dig into, and we need to continue these conversations. But I'm so thankful that everyone's here and very interested and engaged.
And I just noticed that we're 2 minutes away from time. So, wow, it's gone by fast. Kylie, Ames, any final closing thoughts?
Yes, I'm also similarly inspired by people's level of engagement during this conversation and just the enthusiasm that my co-panelists and that our attendees have brought into the space. It's really encouraging to see. This is such an important topic that isn't nearly discussed as frequently enough. I think, as I've seen some people mention, like in the comments, thinking just like creatively and critically about like who might we be able to rely on in these situations is super important, right? I think that we're all kind of conditioned, for those of us that grew up like in the States, to think of, right, like, spouse, parent, child, as the main people that we should be thinking about, like when it comes to either inheritance and or kind of like advanced directives. But we have so many other people in our networks who we love and who love us. And, I think encouraging people to just think about that, right? Like, think beyond the parameters, of our kind of like of our somewhat like limited kind of like a societal like framework or like around support. Just think who might be like really reliably there for you. It could be a neighbor, it could be your local bodega owner if you are that close, perhaps, right? It can be truly anybody. So don't be afraid to just like help folks in your life or yourself think about that, and don't feel like you have to navigate this alone, because there are resources and there are definitely people who you can be connected to help shepherd folks like through this process.
Ames, final comments?
It's incredibly validating to see how many people want this information, to know that, we're on the right track and of doing something that is needed, both by trans and non-binary people, as well as the folks who are trying to help take care of them in community. So I have so much gratitude to Sage and to TLC for helping to work on this, these guiding questions, and to all the folks who